vitiligo, your experiences and your perspectives on that, what you'd like to see in an ideal treatment, if future treatments could be better, how could they be better? And we have 5 panelists who will start off our discussion by sharing their experiences. Before we launch into our panelists' experiences, I want to let you know that our first question for the open discussion question is going to be, what are you currently doing to treat your vitiligo? How has your treatment regimen changed over time and why? And what symptoms would you like to see most improved or resolved by treatment? So we're now about 30 minutes away from people sharing their answers. But if you're interested in responding to that question, please consider sharing via the internet or by calling the 1-800-527-1401 in about 30 minutes. I'd like to welcome our Session 2 panelists and thank them for joining us today. I'm going to start by inviting Jamila to share her experiences with vitiligo. Jamila, if you'd like to turn on your video and unmute.
Yes. Hi, everyone. My name is Jamila. I'm 18 years old, and I'm here to talk about my experience with vitiligo. The first patches to appear were on my face, specifically around my eyes when I was around 8 years old. It was alarming to say the least for something to appear seemingly out of nowhere. It's been around 10 years since my diagnosis. I've tried various methods of treatment and other forms of interventions for my vitiligo, including topical treatments, laser treatment, homeopathic remedies, and makeup. In the beginning stages, I developed patches on my knees, elbows, underarms, and a tiny spot on my neck. Certain areas of my body developed vitiligo later on in life, such as a small spot on my ankle, my chin, behind my ears, and a little patch at the tip of my nose. I have used prescription ointments, such as Protopic, and eczema laser treatment as soon as I was diagnosed. Applying the ointment was very tedious and not something I did frequently because of the sticky texture. I had a more positive experience with the eczema laser. I would go to the dermatologist weekly to receive treatment on all areas of my body that had vitiligo. The most responsive were around my eyes, my knees, my elbows, my underarms, chin, and neck. The spots around my eyes and neck have disappeared since receiving treatment. The pigment came back in little spots, and occasionally I would experience a bit of burning, irritation, and peeling due to the high heat of the laser treatment. The next time that I would return to receive treatment, the strength of the laser would not be increased to prevent burning. However, other than the rare and mild irritation, my experience with eczema laser was overall positive. It wasn't always convenient to get treatment as my schedule got busier. I wasn't able to commute to the clinic as often. Eventually, my schedule no longer permitted me to get weekly treatment, and today I no longer receive treatment. I no longer receive treatment after being treated on and off since my diagnosis. I'm open to being treated again, and in an ideal treatment, I think it would be best if it was a medication that I could administer on my own at home and is cost effective. I'd be okay with mild side effects if the results are promising. I look forward to future discussion about vitiligo, and I'd like to thank you all for taking the time to listen to my experience and for giving us a platform to share our experiences. Also, to my fellow panelists, thank you for being brave enough to share your stories.
Thank you so much, Jamila. I'd like to now turn to Priyanka and Vimla. They are going to share their experiences together as mother and daughter.
I want to start off by thanking the FDA for giving Priyanka and me this great opportunity to share our perspectives, not only as a patient, but also as a caregiver, and join our voices with the rest of the vitiligo community today. It's been a fantastic experience so far. So my 15-year-old daughter, Priyanka, who's here with me today, had her first onset of segmental vitiligo at age 12. The diagnosis was not straightforward, and the treatment options were few, onerous, very expensive, and not easily accessible. Priyanka's treatments over the last 3 to 4 years focused mainly on repigmentation, and that included both surgical as well as non-surgical options, which really were topicals, light treatment, as well as mini punch graft surgery. The treatments ran a long course and failed to yield optimal clinical results, while the vitiligo continued to ravage her body, spreading from her face to the neck, shoulder, arms, and the back. I will say that our journey was a very frustrating one because the rate of progression of a segmental vitiligo was significantly greater than the few specks of repigmentation observed. Overall, the disease and the treatments have resulted in debilitating side effects with a dire impact on her physical, emotional, and psychological health. Priyanka has also needed to gradually shift her treatments as well as treatment regimens due to the lack of immediate response. She actually started with topical creams such as triamcinolone every day and then switched to a combination of tofacitinib in combination with tacrolimus on weekends. She then switched to a combination of topical treatments with light treatment, which lasted for 3 years at twice a week frequency. Most recently, since the start of the pandemic, she has started using the handheld Dermapal unit for light treatment. Overall, the side effects of the light treatment were many, ranging from severe skin inflammation, redness, itching, photosensitivity, burning sensation, blistering, and pain. 2 weeks ago, she actually had the chance to have a mini punch grafting surgery and experienced residual pain in the grafted areas. Today, we earnestly seek the FDA's support as well as the medical community's support to universally recognize vitiligo as a medical condition and not a cosmetic condition to spur new treatments for all patients. We also would love to get support on providing more effective oral, topical, as well as injectable treatments, advanced surgical options, and improved light therapies that permanently repigment and have limited side effects. There was a panelist who also alluded to this exact point at the morning session, so we'd really love to see advancements in this area. And lastly, I'd say we'd love support on robust scientific research as well as clinical trials with broad patient populations, including children. With that, I want to thank you very much again for this great opportunity, and I will now pass it on to Priyanka so she could share her patient perspectives. Thank you.
Hello, my name is Priyanka, and I'm here to talk about my vitiligo journey. So my vitiligo journey to date has been a very difficult one, ranging from shock, disbelief, and frustration to education, advocacy, and sharing of my vitiligo experiences with the community. As I have a darker skin tone, my noticeable vitiligo draws the most attention from others with unwanted stares, disgusted looks, and unspoken questions. Returning to school post-treatments was painful with blisters, caked ointments on my skin, a sore face, and extreme discomfort from clothes chafing against my treated skin. And my recent punch grafting surgery wasn't exactly an easy experience either. I used to swim, bike, skateboard, play the violin at concerts, and manage track and field at my school. But due to my vitiligo and the painful side effects of the treatments, I cannot practice the violin or participate in performances, club meetings, or social gatherings as much as I would like. During the pandemic with remote learning, I am always off camera on Zoom to avoid prying questions from my peers, and this impacts my interactions in class and hinders my level of learning. I have also been the only kid with vitiligo in my entire elementary, middle, and high school, which makes me feel often very isolated. The impact of vitiligo and the lack of treatments to limit disease progression has burdened me psychologically and emotionally and stigmatized me socially in ways that I cannot adequately explain. At a time of my life when I was ready to explore the world, learn new things, and have fun, vitiligo chipped away at my morale, self-esteem, confidence, and quality of life. I know I'm not alone in this journey and request the FDA to help advance better treatments and cure for this disease. Thank you.
Thank you so much, both Priyanka and Vimla. We're now going to turn to Lee to share his experiences. Lee, if you'd like to turn on your video and unmute.
Okay, can everybody hear me?
Yes.
Okay, I'll try to keep my comments brief because I can talk a lot. So let me start off by saying my name is Lee Thomas. I've had vitiligo most of my adult life. That's almost 30 years. I've had pigment come back in about 80% of my body and then go again, which is something that I was not expecting. I've also spent most of my adult life in the public eye. I'm an anchor reporter, and I wrote a book about my disease, about my struggle, and I got the opportunity to tour the world sharing my story, which was honestly quite difficult, but necessary, I felt. And I'll share a quick story. I was on a plane. I was next to a guy. He seemed like he was doing very well. We had a good conversation. The plane's getting ready to land, and the guy says to me, if he says, no offense, but are you a black guy? Because if you're no longer black, then what are you? So I'll answer that question and ask it again. I'm a black man who's had many attempts at trying to stay black, honestly. And I tried everything. Everything that I could afford, I tried. I tried steroids. I tried inhibitors. I tried PUVA. I tried laser, excimer laser. I tried every light treatment that was suggested to me by whatever doctor I could get in front of until I found the best doctor that I could find. For 1 year of my life, I would do the morning show here in my city. I would take off my makeup. I would drive to the hospital, stand in front of a light, completely naked, 3 times a week for about 1 minute. And then I have to put my makeup back on, go back to work, and finish my reports for the day. I would squeeze it right in between the morning show and the noon show. It was very difficult. It was unsustainable. It was not affordable, and I could not do it. I tried every treatment that our country had to offer. Now, I stopped 10 years ago, but after the book, I found myself in Russia on a panel with government officials, with doctors, with drug companies, and that made me very hopeful. That was a decade ago. It seemed like doctors weren't sharing their information a decade ago, but they are now, thanks to Vitiligo Research Foundation, Global Vitiligo Foundation. I love those places. But the best treatment I found was in Germany. It gave me 80% of my pigment back. I want to show everybody what that looked like. It gave me a lot of my pigment back. This is me with my face was about 60-40 there. I had to wear makeup to be on TV to do the right thing. But it was the most successful thing I found. Dr. Schellreuter is her name. But as you can tell, it has gone again. And I don't know what it's going to do. Summertime, sometimes it gets better. I'll leave you guys with this. One question stood out in the survey I was sent. It was about a particular body part. I'll read the question. Is there a particular body area affected by vitiligo, such as face, body, that you would prioritize for treatment? And that question made me laugh because it's like picking your favorite kid, but I get it for clinical purposes. I understand. And my answer is, I would love to have my face back. I was born a black child. I'd like to die a black man. I don't know if that's ever going to be possible for me. But it's important for me to represent people with vitiligo. Hopefully in my lifetime, there'll be an affordable treatment that everybody can have in our country. So I guess I will end by saying I believe in this process. I believe in the FDA, the doctors, the many support groups, including the one that I'm a part of, Be Strong, all of these support groups. And if there's a drug that's in development or a treatment that's in development, I'll leave everyone with this question. And the question is quite simple. It is, what are you? And to me, this entire group, this entire process, is what are we? And hopefully we can be the beginning of the answer. So thank you for giving me the time, FDA, and everybody else. I appreciate it.
Thanks so much, Lee. Really appreciate that. We're now going to turn to Carrie and Bella to hear their experiences. Go ahead, Carrie and Bella, whenever you're ready.
So thank you so much for giving us the opportunity to speak on behalf of myself and Bella and the many teens impacted by vitiligo. Bella is also a member of a teen support group called Purple Patch Teen, part of Vit Friends, that's had a huge impact on her recently and helped her so much. And I just want to share that a lot of what Bella is going to be talking today is represented amongst the group as well. But I thought I'd give an overview of Bella's journey with vitiligo and then turn it over to her to talk more specifically about the treatments and her experiences with them. So Bella was diagnosed with vitiligo just shy of her 13th birthday. I remember doing her hair and noticing some white spots behind her neck. At first, we thought it was tinea versicolor, which is often confused with vitiligo, and it was confirmed that she did have vitiligo. Over the course of about a year, her spots traveled from her neck to other parts of her body, including her knees, her chest, her back, her armpits on both sides, and eventually her face. And she started out taking tacrolimus or using tacrolimus monotherapy as prescribed by her dermatologist. And she was using it on all the different spots for over a year and had very little effect. And when the vitiligo ended up traveling to her face, we sought some different treatment from a specialist, and he prescribed more aggressive therapy that included combination phototherapy with some other creams. And I just want to emphasize before I turn it over to Bella that the process has been quite laborious. It's been extremely challenging. It's been lengthy, just the treatments, the process of it, burdensome just emotionally and financially. Bella has had treatment success, as you can see her face. I did send in some pictures, and I'm sure they'll be on the presentation at some point later, but her face has repigmented, but it's taken a lot to get there. And I just wanted to emphasize again that the journey's not been easy. So I'm going to turn it over to Bella to take you through the treatments, starting out with her experience with tacrolimus.
Hi everyone, I'm Bella. I'm 16 and I'm glad I'm able to share my vitiligo journey with you guys. So as my mom said, first I was prescribed with tacrolimus ointment, and I used that twice per day, and it really wasn't very effective either. I was on it for about a year and I saw really very few results, and there were a lot of other side effects as well. The ointment was very greasy and it often made me break out a little bit, which I wasn't expecting, and there were like red bumps, and it really wasn't a nice ointment to use. So after about a year on that ointment, my doctors prescribed me with another topical steroid to use in addition to tacrolimus. So I used both of those together twice per day. And we also started phototherapy in addition to those two ointments. We use phototherapy 3 times per week, and I'm very fortunate. I do have a phototherapy unit at my house. My parents and I thought it would just be more efficient than having to drive to the dermatologist 3 times per week for like 2 minutes in a white box. So the phototherapy I'm going to talk about for a little bit because I thought it was really important and a big role in my vitiligo journey. So phototherapy really helped. It's supposed to make your vitiligo spots a little bit pink so that they can repigment. But there were a few other side effects that you have to be aware of when you go into a phototherapy unit. One of them is that you have to wear protective eye goggles. And an issue that came up for me was that I did have a vitiligo spot on my eyelid. So we had to weigh the risk benefits of going in wearing goggles versus not wearing goggles. So we actually decided not to wear goggles. My doctor actually suggested I put a pillowcase on my face midway half in, because another thing we were coming across was that my face was getting very, very red, and it was very sensitive to the light, and my vitiligo spots weren't really getting the pink that they needed in order to repigment. So we were kind of shocked by him saying that I should put a pillowcase on my head, but
Yeah, there were a lot of barriers to treatment and different things we had to play with.
right. Yeah, so I think that we just have to play around with it a little bit to see how long you need to be in there without my face burning and with the other spots getting pink. But it did really make a big difference in my journey. The most recent medication that I've been on right now is ruxolitinib. It's a topical cream. I just started it a few months ago. I think it's been really the most effective aside from the phototherapy right now. The issue is that it's extremely expensive. Like the small tube that we have is $350. So you really have to prioritize how you use it.
Right. Bella's doctor had, I think 2 weeks into the treatment, she had used up the little bottle or the little tube, and at that point we called the doctor, and he said, you really just need to choose which spots you want to use it on, because we can't be refilling the prescription every 2 weeks. So Bella's given you kind of a glimpse of her journey, and you know, obviously there's so much more that's gone into it over the last 3 years. She's 16 now. She has had success. However, it's not come without a lot of challenges on a daily basis, and just a lot of just a big burden in terms of time commitment, creams, side effects, emotionally, physically. You know, just so much has gone into it. And I think one of the things that she and I talk about, Bella's relied so much on the phototherapy unit to keep her vitiligo at bay. The concern that I have, and that we talk about moving forward, is you can't take a phototherapy unit with you to college. And she'll be going off to college in a couple years. And so we have some anxiety related to the challenges that go along with treatment when Bella leaves our house. So anyway, thank you so much for the time you've given us to speak today and hearing Bella's story. And we hope that the FDA and that companies can come up with further treatments that'll simplify the whole process.
Thank you so much, Carrie and Bella, for sharing your experiences. And it kind of harkens, your story about having to choose which spots to put the ointment on or the creams on kind of harkens back to what Lee said about having to choose your favorite child as far as choosing the spots. So I think that is probably a theme that we're going to hear quite a bit today. So moving on to Stephen, I see that you have turned on your camera and you are unmuted. So if you wouldn't mind sharing your experiences, I would really, really appreciate that. Thank you.
Thank you. My name is Steve Taylor, and I am a 61-year-old retired Afro-American with vitiligo. Since being diagnosed in 1982, I tried various forms of treatments. For example, I tried different light treatments, different topical medications, and off-label products, to name a few. When my dermatologist first diagnosed me with vitiligo, the initial outbreak was in the hands and elbow area. And he pretty much said in so many words, there is no cure or treatment for this disease. I said, no problem. I accepted it as fact, moved on with my life, I pursued professional counseling, support from my wife, and I made a pact with myself. As long as I don't break out in the face area, I'll deal with it. Well, break out on the face. And because of that, I sought after a second opinion. Now, this dermatologist was more knowledgeable than the previous one because he prescribed a protopic medication for me to apply on my face. Now, I didn't apply it below the neck because the spread of vitiligo was too large of an area to treat. And for the most part, the ointment did prevent the face part of the application from getting worse. The following year, my dermatologist mentioned to me about a new photochemical light treatment called PUVA was now available. I was excited. I said, yeah, sign me up. So for the next 6 months, I traveled 3 days a week, a 2-hour round trip visit to the University Hospital in Ann Arbor, Michigan. I go into this full light treatment process ranging from 15 seconds to 20 minutes at most. And that's all the treatment I had. Now, about 2 months into the treatment process, the stress kicked in. Time, travel, gas, leaving work early, unforeseen circumstances. And did I mention that this was a stressful period in my life? However, halfway through the treatment process, I began to repigment, especially around the face. That was the shot in the arm I needed to stay focused and true to the course. Now, at the end of the 6 months, my dermatologist and I did a risk-benefit assessment, and I decided to discontinue treatments because the risk outweighed the benefits. That is to say, the potential side effects of premature aging of the skin irritation, skin cancer, cataract, not to mention the continued stress of moving forward with the next phase of the prover process. And just a side note, I did try UVB light treatment, but to no avail. So in summary, I am 98% void of color, and I am no longer taking any treatments. And why? I'm still dealing with the emotional stress of the loss of my color, my identity. And I do not want to go through this process again unless there is a cure and not a treatment. In conclusion, I'd like to thank the Food and Drug Administration, all of the dermatologists, all of the researchers, all of the pharmaceutical companies, and all of the vitiligo support groups worldwide working unitedly for the cure. Thank you.
Thank you so much, Steve. Really appreciate that. So once again, these are some really compelling and diverse experiences, and I thank our panelists, Jamila, Priyanka, Vimla, Lee, Carrie, Bella, and Steve for sharing them. I'm now going to take this opportunity to introduce our